What books have you read in business that have helped shape your mindset?
Well, interestingly, I've read Think and Grow Rich.
Think and Grow Rich,
Yes, yeah. I've read this book by Kiyosaki, Rich Dad and Poor Dad. So those two books helped me. Then Parable of Dollar by Sam Adeyemi. Oh, those three books have really reshaped my idea. That Kiyosaki book helped me a lot.
Hi guys, welcome to my YouTube channel. Guys, this has become one of my favorite things to say ever since I started this YouTube channel, and I'm loving it. I want to appreciate every one of you. Thank you so much. Thank you for subscribing, thank you for sharing, and thank you for liking my videos. Research has it that about 70% of healthcare delivery in Nigeria is still by the private sector.
Yeah.
And private practice, this small clinics, small setup, they have major roles to play in all of this. But one of the challenge is that many of them are not able to properly manage this as a business that it is. And a lot of people understand the fact that the call to medicine is a call to to humanity. That is fine. Medicine is a call, it's a divine call. However, there is a business aspect of medicine that should be explored if we really want to offer care that is scalable. I mean, so what would you say about your own transitioning from that mindset?
So I will start by saying this. Medicine, when you are practicing medicine, you should know that you are practicing medicine as a business, not solely as a noble profession. Now, what do I mean by that? What our fathers of medicine has taught us, what they taught us was that when we see patients, we should save life. And when you save life, it's after saving life that you now start asking for money. But in the real sense of it, if you are practicing as a business, when you save life first, before you ask for money, I'm telling you, most of the time you will run at a loss. Lawyers are there. They don't give you facilities, services before collecting money. They collect money before they offer service. So what I do to balance it, because we are dealing with life, and you will not be seen as being wicked, is that as the patient comes, immediately we'll give them response. Nurses will show, my doctor will also come, say, Madam Ekpele, what happened? You say, he had a bike accident, he's bleeding from his brain. Oh, bleeding? What you are having here is called cerebral contusion. We quickly mention the diagnosis. You say, bring cannula, bring IV fluid. You have all these things you are calling to bring. You have not installed them on the body of the patient. You are just calling the names. And as they are bringing it, you will now be telling the woman, who will be responsible for your bill, ma? You understand? Yes, once you see the relatives dragging their feet back and they are looking at themselves as if there is nobody, you ask the question again, who will be are you the one responsible? And they say, the husband is not around. We just saw her by the roadside. The next answer to give is, it is better you go straight to general hospital. That's a better place for your care. Because if you do everything you need to do, the woman is calm, they will not start telling you stories. We don't have money. You are a child of God, to God. They will bring their imam to come and pray for you. They will bring them. Will that pay your staff? Will that buy fuel into your generator? And so you need to understand. And that's why those kind of patients, we go to general hospital. So these are the ways, some of the gimmicks you need to put in place to manage your patients.
All right, sir. All right, thank you very much, sir. What role do you think private practice actually play in the healthcare of Nigeria generally on a bigger scale?
Well, private practice has, in all honesty, taken a lot of load off the shoulders of general government hospitals, and they have helped in to a large extent in reducing unnecessary deaths or cheap deaths, especially when there is a strike or periods when there is unavailability of power in big hospitals. You have other places to fall back on. Then good private hospitals in the country also help you for prompt diagnosis of problem and early referral to teaching hospital before the problem escalates up to levels that are beyond necessary intervention. So it has a vital role if it is well explored. I have some private hospitals in the country now that even do better than some teaching hospitals. So if you go to places like Reddington Hospital in Lagos, you have some places like St. Nicholas Hospital. So you see that, you see medicine, you see it in. I have a colleague, an anesthetist, who discussed with me that there is nothing you need at their ICU, intensive care units in Lagos, that is not available. Adenosine injection, you will find it there. Wow. That an unconscious patient, you want to drive, and maybe the body is not metabolizing substance, you can give adenosine triphosphate. Do ATP injection. I shook my head, say, Jesus, this is another level. You understand? Which you are not likely to see in general hospital. You understand? So private practice has gone far, far, far beyond what people are thinking about. But ask me how much you pay as deposit if you are coming to that ICU. It's 10 million naira.
But the thing is, it is available.
It's available, and people are paying. Exactly. So please, medical student, anywhere you are, don't be under that illusion that there is no money. There is money. When people see that indeed there is value for their money, and the value is well packaged, you understand, they will pay your money. You understand? And you will make it from the practice.
You had always known that you were going to do private practice. I think that decision that you made early actually helped you.
Yes. Know what you want. That's the first thing to say. And understand your own selling points as a medical person. So one of our selling points was 24 hours doctor's coverage, which we still have till date. Number two was the fact that any patient that comes into the hospital, we talk, we just interact well. I made my number accessible to my patients. So that cordiality was not something you can easily find. Some doctors, you ask them, can we have your contact? The way they will look at you, burning high look, they don't know they are losing money. Because if your patient have your number, they can recommend other patients easily. And then somebody will call you now, sir. We want to take your approval to give your number to them. And that's where more money comes in. So that's the way I've been running my practice. And I make sure my patients have the best, and they readily always want to come back.
What you are doing in your own business is that you are creating an environment for people to come to the hospital because they want to come to the hospital, not necessarily because they need. So
I had a woman that had uterovaginal prolapse. That's protrusion of the uterus through the vaginal route. So when I operated this woman, of course, she had been to like 3 different hospitals where they said they couldn't operate her and that she can only be operated in UCH. Somebody now mentioned me, said, can I said, this is beans. So I operated the case. Beautiful outcome, surgery complete, everything well. The woman walked a day after, nothing was coming out. We had removed her catheter. She was urinating normally. The woman happened to be a wife to a pastor. So the pastor came and said, doctor, this will become our church hospital. Wow. Church hospital. Wow. In fact, till date, they are still begging me to come and open elsewhere. Wow. That's close to their church.
Wow. So that means that the business of medicine is not just the business of disease, it's a business of people.
It's a business of people.
It's a business of people. So when you want to go into, when you're considering owning or running your own hospital someday, you understand the fact that when you're going into this business, it's not just to treat the disease, it's not the business of the disease and those clinical conditions, but rather you are in the business of people. Business of people. There's something about giving patients your number that people would always argue against. I think that's come mostly in people that are working for someone
teaching hospital.
Teaching hospital, because
they'll be troubling you
and all. But if as a business oriented person, that is one mindset to actually change.
Do you know the truth? One of the things I do when I'm billing my patient, I build trouble with it. So if I see that you are the type that even before operating you have been calling me incessantly, if your bill should be 800,000, it becomes 1.2 million.
Wow. So
I'm happy that you are even troubling me because I know you pay more.
Wow.
I know the trouble is not trouble for me. It's more money for me.
Wow.
And how do I solve the trouble? Most of the time, I will just say, go to the hospital. I've informed Dr. So and so who is on duty to do this and this and this for you. And the problem is solved. One is to me like 3 months ago. The person had 38 week sized fibroid. Wow. 38 weeks. Multiple fibroids. It's a difficult case, but more difficult case that people run away from. Once you can handle those cases, it brings more money for you. So at times, if you know it's beyond you, call somebody that can handle it. It may be in UCH, it may be elsewhere, to come and handle it in your hospital. That's why your hospital must be equipped, so that those people will have your hospital comfortable for them to work, and you make more money. From here, then you announce yourself more.
Talking about making your hospital comfortable for people, you know, I've found out that when people go into private practice, especially doctors, maybe because of the mindset that they have training in medical school, so they just feel like, oh, I'm a high surgeon, so, and that's what I'm going to do. You know, that aspect of collaboration, what would you say has been your own advantage about collaboration, your experience about collaboration, and how it has impacted your business? You
can never do it alone as a doctor. Networking and collaboration is the key. My hospital, I didn't call it an obstetric hospital or a gynecologist. I call it a multi-specialist hospital. In my hospital, we do orthopedic cases. This week now, we'll be doing an ENT surgery in my hospital. And by weekend, we are doing a urological case. TURP, transurethral resection of the prostate in my hospital. I'm not a urologist. I'm just a gynecologist. But because I have colleagues who have been friends, I usually choose the best of them to operate in my hospital, and I pay them the bill. I put my own mark on it, and I make money. So what am I trying to say? The money they pay you as a gynecologist, the color is not different from the color of the money you receive when you have other specialties come for facilities in your hospital. So it's better you network, you make more money. There are so many bills you still have to pay. So you cannot say it's only when you see gynae case that you eat. So networking is the key. Have friends that you can collaborate with, that you can call when they when you need their attention, and that gives patients confidence that this is a balanced hospital, and they can say this is our family hospital. There is nothing you bring here. In fact, let me tell you what people say in the area. They said if Dr. Olagunju refers you, you are likely dying. Wow. I'm telling you, you are likely dying. Wow. So I remember a case I referred very recently. They were crying already. I said, why are you crying? Oh, everybody. Because they know there is nothing I don't handle in my hospital. Neurosurgical case, I have someone that covers. So that means that it's about the entrepreneurial aspect of you now, because it's all about collaborating, seeing someone that have that skill. You just bring the person on board. You bring the market, you have the customer, you have the facility, so you bring this right skill set, and then you make your money. You pay the person for the skill, you make almost, at times, even double what that other person makes. Wow. So the person will be very happy. He's paying me 1 million. You have collected 3 million. I'm telling you the truth, because you own the theater, you own the instrument, you own the nurses, you are providing energy, electricity, everything. You own the customer. You own the customer too. Without your business acumen, without your business skill, even with all of his surgical skill, he cannot get the money. That's the thing. So it makes sense to network. Yes. Because that way you are enlarging your hospital. So you have to expand your horizon and make sure that your facility is top-notch. I think these are some of the things I've noticed. Talking about having top-notch facility, because actually we will see that some cases are mismanaged, and then they come because they said, oh, they went to a private hospital somewhere. I don't like to call them private hospital. I like to call them peripheral hospital, like they would always tell us. You know, what do you think is the missing gap between those hospitals that mismanage patients that makes it seem as though private practice is bad? Now, the missing gap is that they don't know their limits. Every doctor should know his or her limits. I'm a gynecologist. I know my limits. You can never hear me that I want to go and do craniotomy. Till date, I've done several appendectomies, but since the day I became a fellow of West African College of Surgeons, I stopped doing eniography, appendectomy. I only do gynae cases. How much will I make extra? How much will I pay? So I call general surgeon for their case. You may say that you have done 100 and you will be successful in the 100. The day one messes up, it will mess you up. They will say, you mean a gynecologist did this? So it makes sense to call a specialist. If you're a medical officer, good, you are a doctor. You have the certification as a medical doctor. Treat your common cases that are higher. You can still manage in your hospital by calling in a specialist to manage for you, and you still mark up and get your own pay from it. Yeah. So that's how to prevent mismanagement of patients in your hospital. Yeah. So I want to ask you, in this private practice, has it been fulfilling for you? very fulfilling. I won't lie to you. In fact, if I will say I have a regret, my only regret is that I didn't start early.
Wow.
I'm telling you the truth.
Wow.
If I had started early, I know that I will have more testimonies than what I'm having now.
Wow.
Private practice makes a lot of sense. It's so beautiful doing what you like to do, yet people are paying you for it.
Yeah.
And it pays your bill. You are happy. You are seeing your business grow. Yet your staff that you are working with are also happy with you because they are well remunerated. So it makes a lot of sense.
Thank you so much. I love the fact that the fact that we're able to have this conversation with the doctor. God broke my doctor. I do personally not me.
You shouldn't. You shouldn't.
Thank you so much, sir, for inviting this interview. That's a great interview. And I can say that what you hear is we're going to be having this kind of conversation out of the box conversation. How that we can see beyond the anecdotal epidural not pain. We can see into our own pocket. We can diagnose patient from understanding what vital sign of patient is, temperature, blood pressure, and all of those things. But also we must understand the vital sign of our pocket. We must understand the vital sign of business, management, delegation, risk taking, growth, investment, and all of these things. This and many more are what you are going to be enjoying on this channel. Why have you not subscribed? Is it like you don't want to make money? Alright, that's what I like. Alright, don't forget to share, like, and subscribe to this YouTube channel. Let's spread this good news. Let's share as much as possible. See you in my next video. Bye guys.